Assalamu alaikum doctor. In this video I am discussing a very common video stations, that is cranial nerve 6 palsy, abducence nerve palsy. So what happened in abducence nerve palsy? In the video we will see that I can see a school age child, suppose it's a 4D in hospital or clinical setting. The video showing a doctor doing eye movement test for the child whose eyes are moving freely in all directions except the right eye. So here the right eye we are seeing what is, he cannot moving laterally and shows convergent squint in resting positions. No eye swelling or signs of inflammation in the both eyes. So it is a case of true squint abducence nerve palsy. So remember what we see, that is child eye movement they will show, and eye is moving every directions, but one eye that is not moving laterally, like our picture that we are seeing the right eye that is on resting position, it's not moving the laterally. So it is a case of true squint of abducence nerve palsy. So the differential diagnosis we can give: number one, idiopathic or errors of refractions, trauma, tumor, any infection like CNS infections, cavernous sinus thrombosis, Lyme disease, Ramsay-Hunt syndrome, vascular or hemorrhage, stroke, immuno or Guillain-Barré syndrome and myasthenia. Others are hypertension and migraine, all causes of increased intracranial pressure and idiopathic intracranial hypertension. If bilateral 6-nerve palsy, then Mobius syndrome, GBS, brainstem tumor and Epstein-Barr virus. So again I am telling that DDR, first of all we can say idiopathic errors of refractions. Then we go for tumor, trauma, okay, like any CNS infections like brain infections, cavernous sinus thrombosis. We go the stroke, vascular cause, stroke, hemorrhage. If we go autoimmune, myasthenia gravis, Guillain-Barré syndrome, immunoconditions. Others are hypertension, migraine, and all causes of increased intracranial pressure. Bilateral of 6-nerve palsy occur Mobius syndrome, Guillain-Barré syndrome, brainstem tumor, Epstein-Barr virus. So what history would like to ask? First of all, onset, course and duration, what make it better and what make it worse. It has any diurnal variation, first time or recurrent, degree of affection of his visions, any painful eye movement, fever, recent any illness, flu, sinusitis and sore throat, morning headache and morning throwing up and migraine, and rashes around behind the ear. Any one test his blood pressure, recent trauma and travel, muscle weakness or any weakness in any other part of the body and abnormal gait, head size, shunt, CNS box. So history of any drug intake, growth chart, nutritional history, development history is especially the fine motor. So we are when take the history, we are targeting the DD. First of all, onset, course and duration, anything make it better, anything make it worse. So anything happened before, because trauma is one of the, so any trauma before, anything happened, any viral illness, the Epstein-Barr virus, GBS, these are cause. Then also any other part is weak, whatever any abnormal other part in weak, any history of any tumor, fever, recent illness, flu, sinusitis, sore throat, morning headache, migraine, morning throwing up. Because of brain tumor features are morning headache and morning thrown up and migraine, any rashes around and behind the ear, Ramsay-Hunt syndrome. Anyone measure the blood pressure, because hypertension we know the cause, recent trauma or travel we know, and muscle weakness or any weakness in any part of the body, abnormal gait, head size, shunt, CNS bug, history of a drug intake, growth chart, nutritional history, developmental history, especially fine motor. What do you want to examination? So I want to do the examination ABC and vitals, we know, especially the blood pressure. Then complete eye examinations. Do not forget fundus examination, inspection, visual acuity, visual field, accommodation, pupillary reflex, cornea reflection, cover and uncover test. So complete eye examination, everything, fundus, accommodation reflex, light reflex, pupillary reflex, cover and uncover test, visual field, visual acuity. Full neurological examination, especially the other cranial nerve affections, respiratory examination, abdomen examination, hepatosplenomegaly in malignancy. Examination the head for rash behind the ear and petechiae in throat, and developmental assessment. So what are we are doing? ABC, vitals, blood pressure first of all. Then we do the eye examination. It is eye related, everything, visual acuity, visual field, accommodation reflex, pupillary reflex, cover and uncover test. Then we are going to the abdomen, because malignancy, hepatosplenomegaly, neurology examination very important, all the cranial nerve examination very important. Then we are doing the respiratory examinations, lymph nodes, head examinations, like examination the head and rash behind the ear, petechiae in throat, developmental assessment. Management is actually according to cause. First ABC vitals we do, complete my history and examination, consultant and ophthalmology. So my consultant ophthalmology I will involve, and I will run some test. So CBC, ESR, CRP for in any infection, if suspect meningitis, lumbar puncture, brain tumor, we are doing the MRI of the brain, Epstein-Barr virus, monospot and serology test, and viral Guillain-Barré syndrome, that is monospot test and virology. GBS, we are doing the CSF study, spinal MRI with contrast, anti-ganglioside antibody, blood pressure, spirometry and ECG, Mobius syndrome MRI, genetic study for chromosome 13, Ramsay-Hunter viral swab PCR from the vesicle. Treatment according to the cause plus eye care. We are involving the multidisciplinary team, ophthalmology and neurology. So according to cause, but remember eye cause, so ophthalmology, neurology we are involving here. Okay, so this is all about 6 abducence nerve palsy. Thank you.